come with complaints of bleeding after passing motion or while passing motion. Because of all this bleeding happening while passing motion, sometimes this bleeding is too much, and sometimes this bleeding is small in quantity. Sometimes these patients say they are having swelling around the anal area while and after passing motion. So there are different grades and symptoms according to the grades of the piles. So I will tell you today there are 4 grades of piles, and the symptoms differ as per the grade of the pile. So if a patient has minor bleeding after passing motion, then it can be grade 1 pile. And this grade 1 pile is nothing but just a swelling in the hemorrhoidal cushions. Like these are the cushions in the perianal area given by the nature or God to control over the defecation. So when these cushions get enlarged, we call them as piles. So if it is a minimal enlargement, it is grade 1 piles. Most of the times these grade 1 piles go unnoticed. But if they enlarge to significant extent, then we may call it as grade 2 piles. And often these patients complain of something itching around the anal area. They are feeling some discomfort, and when we in our clinic examine them, we find some swelling in the anal area inside, and that is grade 2 piles, and these patients usually complain of bleeding after passing motion. Now grade 3 piles, when the patient comes to you and says that something is coming out while passing motion and it goes off its own and it bleeds also, then it is grade 3 piles. So these are the symptoms when the patient have grade 3 piles. Now when the patient has grade 4 piles, now he is experiencing all these complaints like bleeding while passing motion and something coming out of anus for longer time, and now the pile which used to go inside after passing motion stays outside, and then it is called as grade 4 piles. So we have different grades of piles, and as per the grades of piles, we have different types of management for the different grades of piles. And in my subsequent videos, we can talk about treatment and how to prevent these piles. Thank you.